The South Bay Survivorship Consortium is made up of members within the community, and we have Torrance Memorial Medical Center, the Torrance Memorial Physicians Network, Cancer Care, California Hematology Oncology Medical Group, Cancer Support Community Redondo Beach, the American Cancer Society, Beach Cities Health District, Kaiser Permanente, South Bay, and Harbor UCLA. So this group began meeting in 2009 with the intention of providing survivorship education in the South Bay community. And so this makes it our 12th year. Today's program, the topic is cancer survivors, integrative medicine, and the use of supplements and vitamins. Our goal tonight is to provide you insights on the role integrative medicine can play in facilitating cancer survivorship, and also give you the latest information on how, when, and where not to include vitamins and supplements in your healthy living plans. Our presenter, Dr. Nicole Alexander Spencer, is an expert, and I know we'll learn a lot tonight from her. So I want to mention just a little bit of Zoom etiquette. Right now, all of your microphones are muted during the presentation. And if you have a question, we ask that you please use the chat box or the chat function to type in your question, and then we'll have an opportunity at the end to have the questions asked and answered. Instead of a sign-in sheet tonight, we're using a participant list that's generated from when you logged into the program. So if for some reason you have a creative name, we just ask you that you either rename yourself on your feature, your chat box feature, or email Miriam to let her know what your real true name is. We're also trying something new for an evaluation for the program. So we won't be mailing any forms to you after this workshop. Instead, at the end of the program, there will be an evaluation that's going to pop up on your screen. And there are about 8 questions, so it's very quick and simple. Shouldn't take you more than just a couple minutes. And then you submit it when you're done. Your answers will be confidential and nobody's going to see your individual responses. So what we're going to do right now is just practice on your computer screen. It's going to ask the question, are you a dog person or a cat person? And then you're going to select one of the choices of whether it's dog, cat, or I want a different choice. So you should be able to see those coming up on your screen right now. So if you can all interact with that.
Cancer Research Center, this is Miriam. Can I help you?
I see a number of you guys answering right now.
Okay, if you give me your email.
So it looks like right now, dog is in the lead. And we'll end the poll in about, I don't know, maybe 15 seconds here. Did everybody get a chance to answer on the poll? Are you a dog person, cat person, or I want a different choice? All right, so it looks like we are sharing the poll results. And dog people win by 61%, cat 29%, and I want a different choice, 10%. So anyways, this is just a really quick demo to show you what this polling option looks like at the end when we do our evaluation. So let's see. We also have a handout on the topic that's going to be emailed to you, and it'll also be posted on the webpage. So the handout's going to give you links to several reputable websites for additional information, and it has a picture of the anti-inflammatory diet pyramid that will be discussed in the program. Our next programs that are coming up for August and October, we've got our August topic already selected, which will be cardio oncology with Dr. Brenton Bauer. And the October topic will most likely be on healthy sleep. So look out for those in the future when we advertise those. So tonight, though, we really do want to thank the consortium members and the volunteers who've helped put this on. Don't forget to stay around for that quick evaluation at the end of the presentation. And now I'd like to introduce our speaker for tonight, Dr. Alexander Spencer. She is a board certified family medicine doctor. She completed her undergraduate training at University of California, LA, then went on to complete her medical degree at Howard University College of Medicine. After completing her residency in family medicine at UCLA, Dr. Alexander Spencer completed a master's degree in spiritual psychology at the University of Santa Monica. In addition, Dr. Alexander Spencer completed a fellowship in integrative medicine at the University of Arizona under Dr. Andrew Weil. She has additional training in urgent care medicine, adolescent health, women's health, and weight loss medicine. She is a strong supporter of holistic, comprehensive health care for her patients, and she believes that the mind and body are connected, and when one system is ill, it throws off everything. Dr. Alexander Spencer supports her patients in getting adequate rest and recovery, having balance in their work lives. She encourages healthy relationships while eating healthy food options and being active. Dr. Alexander Spencer grew up in San Diego, California, and enjoys traveling, being outdoors, exercising, watching movies, and spending time with loved ones. So please help me welcome Dr. Alexander Spencer.
Hello, thank you so much. I wish we could all be in person. I'm a touchy-feely person, but we have to do this for now to be safe. And thank you for the introduction, Nancy. I'm going to share my screen. Let's see. And as Nancy mentioned, I'm family medicine board certified. I did a fellowship in integrative medicine. And I'm also the chair of the Integrative Medicine Committee at Torrance Memorial. So let's get on with our talk tonight, integrative medicine and supplements. So the goals tonight would be to define integrative medicine, compare the preventative cancer recommendations from the top societies, discuss anti-cancer diets, discuss a variety of supplements that are helpful during and after cancer treatment, discuss supplements that help with complications of cancer treatment or post-cancer treatment, discuss supplements to avoid, and discuss how stress and sleep affect our immunity in association with cancer. I'm just going to see if I can move the box over. There we go. So cancer prevention. Cancer is a disease caused by an uncontrolled division of abnormal cells in the part of a body. And cancer is multifactorial. Genetics, toxins, different exposures to viruses, an unhealthy diet and activity all can contribute to one's cancer susceptibility, as well as epigenetics, which is your kind of genetic makeup. So prevention by annual checkups with your doctor is strongly recommended. That's why we have cancer screenings, and healthy lifestyle is the best thing that you can do now with your physician. And all my references are American Cancer Society and United States Preventative Service Task Force, and I'll abbreviate it USPSTF. That's the one that all the doctors do, and that's the gold standard for cancer. And then we're referencing American Institute of Cancer Research as well. Let's see. So I'm not able to advance for some reason. Let's see if we can do it again. There we go. So let's talk about, did I miss it? Okay, integrative medicine. Integrative medicine combines conventional Western medicine with traditional and complementary therapies. Traditional medicine includes acupuncture, Ayurvedic, homeopathy. It includes holistic model, which means that the whole mind, body, soul, and emotions are connected. And we really focus on the foundation, which is diet, sleep, stress reduction and exercise. Okay. Complementary therapies include acupuncture, exercise, yoga, tai chi, massage, nutrition, Reiki, healing touch, music therapy, mindfulness, meditation, psychotherapy, and supplements, just to name a few. There's way more out there, but these are kind of the mainstream. And integrative therapies improve health and decrease disease by enhancing the body's innate potential. And I'm going to repeat that again because that's really key. Integrative therapies improve your health and decrease disease by enhancing your own body's innate healing potential. So the body is amazing. So cancer prevention recommendations. So this is the American Institute of Cancer Research. This is their recommendations, and I'll go over a couple of recommendations. So it may sound repetitive, but at least we'll get it in our brains because repetition helps with that. So being a healthy weight, that means your BMI 18 to 24 or 25, under 25. And you get that by comparing your height to your weight, and you can ask your physician as well. You being physically fit. So I tell my patients exercising 30 minutes, 5 days a week, or a total of 150 minutes a week of regular exercise is good. If you do vigorous exercise, you can lower that to 75 minutes a week. Eating whole grain vegetables, fruits and beans, and consuming at least 30 grams of fiber from your food, including most of these in all your meals, and eating a diet high in plant foods. So at least 5 servings of fruits and vegetables a day. And limiting fast food and junk foods, and those that are processed or low in micronutrients, such as those from white flours, bread, pasta, cakes, pastries, and cookies. The Cancer Institute also recommends limiting red meat and processed meat. So their recommendation is to limit it to 3 days a week and to avoid processed meat altogether. Limiting sugar or avoiding sugar sweetened beverages, which is a leading cause of not only cancer or inflammation and sugar. The sugar intake increases inflammation, but it also is a leading cause of diabetes. So drinking mostly water and unsweetened drinks is very wise. Limiting alcohol consumption. So it's best not to drink alcohol at all, and not using supplements for cancer prevention. So the cancer prevention from the USPSTF recommends tobacco in no safe form. So not to smoke, chew, or vape. So encouraging, if you need help to stop smoking, then you should see your physician. There's medications, there's hypnosis, and classes that Torrance Memorial even recommends. So I would highly recommend that be your number one goal if you're smoking now. And if you're a heavy smoker, you can get a lung cancer screen, and we'll talk about that a little later. So again, they recommend being at a normal weight, because overweight and obesity increases your risk of certain type of cancers due to increasing estrogen levels and inflammation. So studies show obesity is associated with a 40% increased risk of cancer. And cancers that are associated with obesity include breast in postmenopausal women, ovarian, pancreatic, endometrial, esophageal, stomach, renal, colorectal, gallbladder, thyroid, and stomach. And the best way to control weight is by limiting your portion sizes, eating 5 servings of fruits and vegetables, limiting your sugar and fat and processed food intake, and sugar sweetened drinks, as well as avoid eating late at night. So alcohol use, alcohol is a toxin. So if you don't drink, don't start drinking. If you do drink, make sure it's limited, 2 drinks a day for men and 1 drink a day for women. And the serving sizes vary, 12 ounces for beer, etc. So make sure, ladies or gentlemen, if you're drinking wine, it's a few ounces, not the whole glass. And if you do drink red wine, is preferred because of the resveratrol, and we'll talk about that a little later. So why do we do cancer screenings? Because cancer screenings are tests used to find cancer in people without symptoms. So finding cancer early decreases or increases your chance to treat, cure, and prevent death. And unfortunately, not all cancers have standardized testing. or screenings. But the top 5 cancer screenings are breast, cervical, prostate, lung, and colon. I'll go through those briefly. Breast cancer screening starts at age 40 to 74 with a yearly mammogram. Cervical cancer screening age 21 to 65 with a pap smear every 3 to 5 years. Colon cancer 50 to 75. If you have a family history or if you're African American, it starts at age 45 with a gold standard colonoscopy every 5 to 10 years. They do have stool cards as well as an alternative. Prostate cancer screening ages 50 to 69. That's with a PSA blood test and a digital rectal exam, and that's yearly as well. Lung cancer screening is age 50 to 80 with a low dose CT scan of the lung. For current heavy smokers or those who have quit within 15 years, for those who have smoked 20 years, a pack a day or more. So let's talk about the integrative medicine. So we talked about some of the cancer institutes and the standards that Western medicine uses for cancer prevention. Integrative medicine, you will see some overlap and we'll see what the contrast and overlap are. So maintaining a normal weight, 40% of cancers are associated with obesity, like we said before, and really let food be thy medicine, because an anti-inflammatory diet is the foundation of integrative medicine. So eating mostly plant-based, 5 to 7 servings of fruits and vegetables, lean meat, mostly fish, including healthy fats from oils, nuts, and avocados. So good examples of an anti-inflammatory diet would be a Mediterranean diet, Japanese diet, limiting fast food, processed food, hydrogenated, and high fructose corn syrup. Also, exercise, again, we're recommending 150 to 300 minutes per week. So a little bit more exercise with a variety of exercise is important, and including core, cardio, muscle strengthening, and stretching. So it's important to have all those. Limiting alcohol use and avoiding tobacco use. So let's talk about nutrition a little more. So nutrition is the most important. You get your vitamins through your food. So eating a variety of colorful fruits and vegetables each day, especially cruciferous vegetables such as Brussels sprouts and broccoli, are very healthy. Anti-inflammatory Mediterranean diets, again, I encourage you guys to look that up, find recipes, be creative with that. Antioxidants are absorbed by your diets, and supplements can add to a very healthy, clean dietary intake. Eating a high fiber diet where 2/3 of your plate is plant foods such as whole grains, vegetables, fruits, beans, and nuts, where the remaining 1/3 is filled with animal-based proteins such as seafood, poultry, or dairy. Avoiding or limiting red meats, processed meats, so avoiding cured, smoked, pickled foods such as bacon, sausage, deli meats. Choosing low-fat dairy products and minimizing consumption of high-carb white foods to help maintain and lose weight, such as white rice, potatoes, breads, and pasta. So the Adventist religion did a health studies diet comparison, and they really encouraged vegan diets. So the vegan diet, and let's talk about vegan diet versus vegetarian and pescatarian or flexitarian. Vegan diets are associated with 14% decrease incidence in all cancers combined. There's a decreased risk in female-specific cancers noted in vegans. Vegans have a 73% higher risk of urinary tract cancers compared to non-vegans. Vegans need to supplement with vitamin B12 because they don't have any animal-based nutrients, and vitamin B12 is only through animal products. Vegetarians have a lower risk of colorectal cancer than meat eaters, but pesco-vegetarians have an even lower risk of colorectal cancer than vegetarians. So that's an interesting outcome. Vegetarianism did not decrease the risk of mortality for stomach, colorectal, lung, prostate cancers, and vegetarian diets benefit men more than women. So what that means is, yes, we want you to eat more plant-based foods. There are some associated benefits. If you do eat meat, make it fish and eat less of it. there's I hope you guys understand the incidence of disease versus the mortality and all that, because that can get a little tricky. So let's talk about the supplements. So supplements. So taking a variety of supplements can help manage ailments, symptoms, and aid to the immune system. I'm integrative, and I'm also primary care for a lot of patients, and I see a lot of people taking too many supplements, and they're very costly. So hopefully you can hone down on some of the supplements you may need. So don't take too many supplements. The supplements can add to, again, a healthy, clean diet, and you want to individualize your approach to your supplements depending on your health concerns. So schedule an appointment with the integrative provider that is knowledgeable about supplements. Bring your supplements as well, because we need to read the back of the ingredients to see what's in them. And then there are no recommended supplements for cancer prevention. So that's repeated, because they cannot make that claim, and they do not make that claim. Okay. So let's talk about the supplements again. Let me just move this box over a little bit. Okay, here we go. So using supplements help to improve your quality of life, reduce treatment-related side effects, and additional cancer control. They're controversial during active cancer treatment, but generally we recommend to stop most supplements, but check with the oncologist, because some of the supplements are helpful. Vitamin D, the number one, I put this number one because it's kind of been more in favor in overall, especially with COVID. Vitamin D deficiency is associated with increased risk of mortality, cardiac disease, and cancer. Vitamin D can decrease ovarian cancer mortality, and it reduces the risk of colorectal cancer when supplemented with calcium. So that's pretty impressive. It also reduces breast cancer reoccurrence risk when the vitamin D goal is between 40 and 60. So that's a good fact that I learned during this lecture. Mushrooms. So mushrooms come in a variety of forms. Turkey tail, masaki, button, shiitake, and other medicinal mushrooms have immune modulating activity for both prevention and treatment. And mushrooms how they work is they increase the mitocyte or immune function. So they're adaptogens. Adaptogen, we don't have an equivalent in Western medicine, but it helps the body kind of cope. That's the best way I can describe an adaptogen. Mushrooms are edible. They're best to be eaten, but they must be cooked. Never, never raw. Do not cut up mushrooms and put them in your salad raw. Okay. Medicinal mushrooms come in capsule formulations as well. There's a slow acceptance in the US because most of the studies are done in Asia and not translated, but this is really something that I think will come into favor later on. Maybe this group is more knowledgeable about supplements and they're taking them already. So the survival rate with those that take mushroom is 29%, and disease-free survival increases by 28%. So that's pretty impressive. I would definitely tell this group to start supplementing or cooking more mushrooms. And you can't use mushrooms in liver cancer or poor liver function, and it should be avoided with lymphoma or leukemias because of its stimulating effect on the immune system. So turmeric. Turmeric is a botanical used in Ayurvedic medicine. It's a culinary spice. Curcumin is the polyphenol, the yellow pigment in the turmeric root, and that's the medicinal part of the turmeric used in Asia. It has anti-tumor activity. It downregulates inflammation and angiogenesis pathways that support tumor growth, especially in colon cancer. It reverses chemotherapy resistance and blocks carcinogen-induced tumors in rodents. It augments conventional treatment. So the dose, 200 to 40 curcumin if you're taking a pill, and it can help reduce body joint and aches. So a lot of people take this for arthritis. And if you do cook it, it's hard to get enough, but you can always, cook your mushrooms with your turmeric, but make sure you add pepper with the turmeric because that helps it digest better. Astrologus. This is a great supplement for boosting immunity. It reduces tumor growth and cachexia by reducing inflammatory cytokines and improves innate cytotoxicity, the T cell immunity, and it reduces proliferative factors. So astrologus was shown to improve overall survival as well and improve quality of life. So it helps boost the immune system. I use this one a lot when people have recurrent colds or in the cold and flu season. This is my go-to for those with quote unquote weak immune systems. Melatonin. So this is a natural hormone in our body. It helps with sleep. Melatonin starting dose is 3 milligrams, and I'll titrate up to 5 or 10. And the studies of melatonin showed that 20 milligrams improved complete and partial remission and improved survival rates and decreased radiation and chemotherapy related side effects, including thrombocytopenia, neurotoxicity, fatigue, and neuropathy. So very great supplement. I use it all the time for sleep, but hopefully it can be used when you're actively getting treatment if you're undergoing chemotherapy. Green tea. See, I'm getting you guys ready for your lunch tomorrow. You'll have mushrooms with turmeric, pepper, and you have some green tea. So the EGCHH is a polyphenol extracted from green tea. It has anti-cancer actions, and green tea reduce the incidence of breast cancer and reoccurrence while drinking up to 5 cups a day. Colon cancer risk is reduced in those taking 900 milligrams of green tea extract daily, and it lowers the incidence of gynecologic cancers and leukemia with green tea consumption. So green tea is one of those ones that should be in your cabinets. Leukopenin is a potent dietary antioxidant, is associated with decreased risk of prostate cancer. It prevents gastric cancer. It inhibits H. pylori, and its anti-proliferative and anti-inflammatory effects on gastric wall of the stomach. The best sources are tomato products such as spaghetti sauce, and it's better when the tomatoes are cooked. It's also found in small amounts in watermelon, guava, and pink grapefruit. Resveratrol. This is a polyphenol found in the skin of dark grapes and in red wine, berries, plums. Its dose is 100 milligrams of trans resveratrol daily to increase the protective cancer effects and reduce inflammation. And that's why we prefer red wine if you do drink, but don't start drinking, okay? And because it's also good for your health. Aloe vera gel is benefits the skin from irritation and minor burns. So the research suggests using it for wound healing, anti-inflammatory, antifungal active property. It has properties to protect against radiation, mucositis, and oral candidiasis. So there's a swish and swallow formulation. So make sure it's good. If you're using it internally, it's safe for that. And avoid with the gel products with this product in there, because that is not healthy. Milk thistle. Milk thistle seed is dosed at 420 to 640 milligrams a day. It has anti-proliferative effects. It's antiptotic and anti-androgenic actions. What that means is it decreases the proliferation, so it decreases the replication, apoptosis. It helps cancer cells die, and it decreases the blood flow to cancer. It protects the liver. So this is good for toxin-induced liver damage. So if I had patients that had taken too much Tylenol or has elevated liver enzyme, this is a very good supplement. Also, if you drink alcohol, I would recommend you take milk thistle, and it reduces chemotherapy hepatotoxicity. So glutamine is a supplement, but it's not safe in malignant disease because it acts like glucose for tumor growth. So, but glutamine is good for short-term use to treat neuropathy, diarrhea, mucositis, and it's a non-essential amino acid. So additional supplements that are my favorite would be valerian root, because sleep is always prioritized, and we'll talk about sleep a little bit after this. Ashwagandha for reducing stress and anxiety. Ginseng for fatigue. That's a hot topic for my patients, people that are tired. Ginseng is clinically proven. Cannabis for relieving nausea and decreasing pain, and St. John's wort for mood and depression. So neuropathy is a big complication from chemotherapy and cancer survivors. So these are evidence label A recommendations. That means that they are clinically proven to treat and improve neuropathy. So acupuncture. It was practiced in China for 50 years for diabetic neuropathy. The needles increase the blood flow, create ionic changes, release neurotransmitters, and that decreases the comfort. Alpha-lipoic acid is an antioxidant. It also decreases free radicals, and it helps with neuropathy. Topical capsaicin is derived from chili peppers, stimulates afferent C fibers with that burning irritation, releases substance P, and reduces pain. And then cannabis is known to treat chronic pain as well. So immunity, I was asked to talk about the immune system a little more. This was shared on my COVID slide recently. So when because we're in a pandemic and definitely during cold and flu, or if you have viruses, this is the kind of cocktail I recommend to increase immunity, or if you have a weakened immunity after chemotherapy. So zinc inhibits the virus from getting into the cell and decreases its virulence. So the dose is 15 to 30 milligrams daily. A lozenge is preferred because it acts directly on where the upper respiratory tract cells. Vitamin C, I love this daily at 500. It shortens the frequency and duration and severity of colds and pneumonia, and you can increase it up to 3,000 milligrams when you have an acute infection. Again, melatonin, it's an anti-inflammatory. It reduces oxidative lung injury and inflammatory cell recruitment. So very key recommendation when someone has a pneumonia or a COVID infection. Curcumin, again, because turmeric, it has an anti-inflammatory action and antiviral effects against the viruses. And vitamin D, again, activating the immune cells. So make sure you have those in your medicine cabinet. Fatigue is another one, kind of a top complaint that I get from patients. And it's tricky because you have to rule out depression, chronic fatigue, low thyroid, cardiac problems, anemia, too much coffee, not good sleep. So you got to make sure you're getting enough sleep, at least 7 hours. If you're getting less than 7 hours, then you're really not recovering enough at night. Exercising regularly. And then again, ginseng is clinically proven to improve cancer-related fatigue. So there's some cautions that I want you guys to note. The botanicals known to induce or inhibit the cytochrome P450. This is the breakdown system, and some of the supplements can increase or decrease concentrations and then affect medications. Other medications that you're taking, it can be affected. So St. John's wort and echinacea, grapeseed, kava, garlic decrease the system. And so sometimes the medications you're taking aren't as effective. Whereas ginkgo and golden seal can increase and cause the other medications you're taking to be too toxic. And then resveratrol and cannabis can do the same. So those, I really want you to be cautious when you're taking these. And garlic you can cook with as well, but sometimes taking supplements, you have to be cautious. Mind-body therapies. This is kind of rounding third. We talked about nutrition. We talked about supplements. Well, mind-body therapies are as important too, because everything's connected. And if people have chronic stress, so acute stress is normal, that's okay, but chronic stress is daily stress, and that really can beat this immune system down. And when you have chronic stress, it can lead to depression where you're thinking of the past all the time, or anxiety where you're thinking of future. So way to cope with stress is very important, and I talk about this all the time with my patients. So exercising, that's key. It checks a lot of boxes. It's good for your heart. It's good for your mental state. It's good for your, stress level. Yoga, Tai Chi, guided imagery, meditation, and practicing mindfulness. That means being where you're at, knowing what you're doing when you're doing it. I am taking this glass and I'm going to drink this right now instead of like multitasking. Therapy is good, talking to a therapist, support groups, having connections with friends, avoiding social media and news, and limiting those more negative things. So how can we stress less? We need to improve our resilience. So practice healthy relationship boundaries with those around you. Be mindful, balance between giving and receiving. Learn to say yes or no. Make quality connections with people, volunteer, join groups, accept help. So as we're aging, sometimes it's hard, or if we're sick and we're getting treatment, it's hard to accept help. That's very important. People want to help. Avoid seeing crises as insurmountable problems. Change your reaction. Avoid overreacting. Move toward your goals. Work towards something. Write it down. Have realistic goals. Take small steps to achieve them so it's not overwhelming. Take decisive actions every day. Don't wish a situation to go away, and don't ignore your problems. Look for opportunities for self-discovery. People learning hardships, and it helps you discover and grow. Ways to improve resilience. Again, nurture positive views of yourself, develop confidence. There's only one of you, so share it with those in a positive way. Keep things in perspective. Look at a long-term perspective when dealing with stressful situations. Avoid blowing minor events out of proportion. Maintain a hopeful outlook. Having a positive attitude helps to overcome hardships. Take care of yourself. Pay attention to your own needs. Eat well, exercise regularly, engage in enjoyable activities, and get enough rest. Keep a journal, meditate, self-reflect, and have your spiritual practice. So sleep. Another thing that I prioritize with patients is sleep. It needs to be prioritized. Again, at least 7 hours. If you're not getting 7 hours, you have to work at it. Sleep is a highly complex state that affects the body, mind, memory. So if you're having memory problems, it could be the sleep too. Emotions, respiratory, immune system, cardiovascular system. Sleep is related to wellness. So lack of sleep is associated with higher levels of depression. About a lot of people, 40 million Americans struggle with insomnia, and sleep disorders are very common in women. Younger people have more sleep onset problems related to anxiety, while older people have harder times maintaining their sleep, and early morning awakenings are associated with depression. Compromised sleep increases accidents, disrupts cognitive performance, increases medical disorders such as cardiovascular disease, cancer, autoimmunity, infection, and obesity. So sleep hygiene, this is one of the first things I tell patients. I don't give people pills. I say you have to be mindful about your bedtime, set regular bedtimes, the same in the weekday and the weekend, and maintain regular exercise, meal times, and avoid napping if you have insomnia. Limit caffeine, nicotine, alcohol, and other drugs. Avoid exercising 4 hours prior to bed due to the rise in core body temperature. Avoid hard to digest foods or high glycemic foods at bedtimes. Better to have complex carbs. Create a healthy sleep environment, cool, completely dark, quiet, safe. Make sure it's green, using a HEPA filter, using organic, non-toxic bedding. You're in the bed for 8 hours every night, so that's a third of your life. So make sure it's very clean. Limit screen time, which causes melatonin to be suppressed. Use blue light filters. So that should be on all your screens. If you watch TV at night, or your iPhones, or even if you read at night, make sure it's blue filtered light. Avoid clock watching at night. Use non-illuminated battery operated light so you can have subtle EMF radiation. Use cognitive behavioral therapy such as meditation, biofeedback, guided imagery. And you can look at for CBT for insomnia with Dr. Greg Jacobs. Use the bedroom for sex and sleep only. No TV in the bed. Go to bed only when sleepy, and get out of bed if you're awake for more than 20 minutes. And then using natural short-term supplements like a valerian root, passion flower, lemon balm, lavender, chamomile, and hops. These are all great. Sometimes you can find them in one formulation, and that's a nice thing. If you are anxious about something or having problems falling asleep, you could take it in tea or a supplement. Again, melatonin is useful in aging populations who have circadian irregularities. L-theanine is safe as well. It promotes sleep and it helps with anxiety and causes a relaxation effect. And always couple supplements with sleep hygiene. And what I like about supplements is that they don't have any side effects in general. Just the ones I told you can speed up things, but they're generally safe. There's no habit forming with if you take melatonin for, sleep every night. And sleeping is about letting go and surrendering to sleep onset. You can't force sleep, and you can't be on your computer and then okay, it's time for bed, and then wonder why you can't go to bed. You have to lull yourself to bed like a baby. We had to rock the babies when they were little. Causes of insomnia could also be reflux, restless leg, chronic pain, trauma, caffeine, alcohol, prescription medicines, over-the-counter drugs, and shift work. So in summary, nutrition is key. An anti-inflammatory diet that's clean, eating mostly plant-based, obtaining nutrients by food and a variety of colorful fruits and vegetables, beans, nuts, healthy fats, oils, and fish. Supplements and botanicals can add to a healthy lifestyle, and supplements need to be customized to your individual needs by integrative medicine provider, naturopath, chiropractic, licensed, trained health professional that's knowledgeable about supplements. And well-being is closely connected to a healthy lifestyle, which includes a healthy diet, exercise, getting good sleep, healthy relationships. And the mind and body are all connected, and we want to prevent cancer and maintain a cancer-free life by maintaining a healthy lifestyle and enhancing your immunity. Thank you again, and I will welcome any questions.
So if you have any questions, definitely put those into the chat box. And I know there's a couple in there already, so please feel free to use the chat box with your questions. And then at the end of our question and answer, that's when we'll have the survey come up or the evaluation come up on the screen. So the first question is, what if you have hypothyroidism? We were told not to eat cruciferous vegetables. Is that correct?
Well, for my hypothyroid patients, I don't limit those vegetables. If you're supplementing with medications, then you can eat a variety of foods, and I haven't had any conflicts with that. So I'd rather you eat a variety of fruits and vegetables, and I haven't seen that be a problem with my hypothyroid patients. So it's fine.
Okay, next question is saying, my husband will be finishing up his adjuvant chemo at Hunt Cancer Center. We'd like guidance on aftercare. Do you see patients as an integrative doctor?
I do see patients as an integrative doctor. I am a primary care. I think my panel's open as well. So a lot of the Hunt Cancer Centers if patients don't have a primary care, they'll send them to me. Or if someone wants their primary care, I can recommend an integrative practitioner in the community.
Okay, and then next question here is melatonin recommended if one is diagnosed with hormone positive breast cancer?
Yes, melatonin is fine. It's a natural hormone in your body, and it only affects your sleep. It's not an estrogen or hormonal that it affects breast cancer. So with breast cancer, you have to avoid estrogen type hormonal products.
Okay, and we have someone complimenting you, saying that they love this viewpoint. Thank you so much, and that it makes good common sense. But next question here is, why must mushrooms be cooked and not raw?
Some mushrooms have small amounts of toxins in them, and they're better absorbed in that form, in the cooked form.
Okay. Next question says, is it okay to eat kale and spinach raw?
Yes, that's fine. Eat
Um,
lots of kale and spinach. I love kale and spinach. Smoothies, raw, cooked. It's a very good vegetable, both of those.
Next question says, will we get your contact info again? So I imagine she's talking about maybe that last slide.
Oh, yeah. Should I put that up?
You can, let's finish with the questions. Perhaps Miriam or Nita could also put that information in the chat box
Yeah.
too. That would. Okay, next question is, what is the brand of red yeast rice supplement? I'm just guessing, do you recommend?
I don't really, that's one of the things, doctors, we can't recommend brands. That's a conflict, but I do recommend red yeast rice for those with high cholesterol and plant sterols. That's a whole nother lecture, but usually I recommend my patients, they can go to Sprouts or Whole Foods to get those supplements. I also do work with an integrative pharmacy that has formulations of different things based on categories for those patients that come see me.
Okay, and this one is more of a statement, but saying my oncologist told me to not take a multivitamin supplement while being treated for breast cancer. Vitamins are as helpful to cancer cells as normal cells.
Yeah, so you have to, the oncologist trumps what I say here. And because the chemotherapy and those treatments, it's true, whatever you give your good cells, the cancer cells like it too. So that's why a lot of times we say stop the supplements altogether. So if they say stop it, you have to stop it. And I support that. So you can resume it afterwards. But usually chemo is a short period of time. You can stop those supplements.
Okay. And what are your thoughts about using stevia instead of sugar?
I like stevia. It's a natural sweetener. Sugar causes inflammation. So substituting any type of sugar, stevia is fine.
Next question here says, the green tea recommendation said 5 cups a day. Does drinking decaffeinated or caffeinated make a difference?
No, it doesn't, because it has the polyphenols in there. So you can do decaf. Of course, don't drink 5 cups. I mean, you can start with 1 cup. That's going to be helpful. But if you drink water and you drink green tea sometimes and iced green tea, but if you're, drinking green tea at night, you probably do want to do a decaf, or if you're sensitive to caffeine, because green tea has caffeine in it.
Okay, next question here says, can melatonin be used as a daily regimen? Maybe
Absolutely.
insomnia, or is there a time limit on use? And what is the recommended dose?
So melatonin can be used nightly, every night. There's no habit forming. It's a natural supplement or a natural hormone in your body. I usually start at 3 milligrams, and then you can titrate up to 5 or 10. But, it's, again, I use melatonin as, I have a lot on my mind, I'm going to take it tonight. Or you're having, it's going to be a hard time to go to sleep. I mean, you can take it every day, but that's how I use it.
Okay. The next question says, what's the best way to take aloe vera for vocal cord cancer? Should I drink aloe vera juice?
I would, if you have active cancer, I would probably talk to the oncologist. I think drinking aloe vera juices would be fine, because people drink aloe vera juice just normally. But again, I would talk to the oncologist, because I wouldn't want to be feeding the cancer cells. Aloe vera is very soothing and healing, but I don't know the studies exactly on throat cancer.
Okay. What are your thoughts about hyperbaric oxygen treatments?
The studies are still out for that. I would need to do a little bit more research. I know some people are using it, and right now, when we don't have enough studies to kind of say yay or nay, I say, well, how do you feel afterwards? And if it doesn't cause you any side effects or any problems and you feel better, then, I support it. Right now, I don't hear any negatives about it.
Okay, good to know. Next question here. I put powdered mushrooms in my protein shake. Is that okay?
Yeah, that's you're getting the mushrooms in. So if you don't, as long as, yeah, that's a supplementation form and you can mix it up in a smoothie, that's a perfect form to do that.
Okay. And I see Miriam has put your information into the chat box. Nicole Alexander Spencer, Integrative Medicine Chair at Torrance Memorial, office number 310-784-6300. So you can refer to the chat if you need to look at that again. Let's see. Next question. Is it okay to consume soy products if you have hormone positive breast cancer?
So that's tricky because processed soy is the problem. You don't want to do processed soy, but if you're eating whole soybeans, that's totally fine. So, processed is like soy milk. So we say no if it's hormone positive because natural forms, again, of soybean are fine, but it's when you process them that makes it more dangerous when you have hormone positive breast cancer. So controversial, but that's kind of my 2 cents. If you like soybeans, then you can eat those.
Do you work with reflux problems with diet only or both diet and meds?
For gastric reflux?
It says reflux problems, so I would assume that.
Okay. So reflux problems would be diet first and then medications or supplements. So GI, GI problems are very helpful doing it as an integrative approach because a lot of things we eat are cause a lot of gut issues. So reflux, especially, there's certain lifestyle things you can recommend. There's certain, licorice and formulations that are integrative supplements that are really helpful. And then there's medication. So that's kind of how I approach patients and everything. So if you're having a sleep problem, I'll do sleep hygiene, the melatonin and natural supplements. And then there are other Western medications that are stronger that we can use if the integrative approaches don't work.
Right. Here's a question. Should you take vitamin K with vitamin D?
Oh, that's a good question. I have to look up the studies. I did hear about that and I was taking the vitamin D and K and to see if I felt any different. But I have to defer that question because I'm a study person. So some of the things don't have evidence base. And if you, again, feel better with it, you can. But what makes integrative medicine really kind of less woo-woo, should I say, is that there's evidence based, there's scientific evidence behind it. We're not just treating you with supplements because we heard they make you feel good. There's evidence and science behind it. So I'd have to look that one up.
Okay. Next question says, pickled foods were mentioned as being bad. What about pickles, sauerkraut, kimchi? Do you know why this is the second question, but do you know why vegans have higher bladder cancer risk?
I like naturally pickled, sauerkraut is fine. But sometimes if you have sauerkraut or those pickled in jars that have been on the jars and they have chemicals and preservatives in it, those are what we want you to stay away from. If someone's pickling it themselves with vinegar and all that, that's totally fine. So that's what we're trying to avoid. And I'm not sure why vegetarians have a higher risk of bladder cancer. Maybe because they're filtering more.
Okay. Here's a question everyone wants to know. Is every form of chocolate bad?
Absolutely not. We recommend the cacao. If it has at least 70% or higher, you can have a piece of dark chocolate every night. That has polyphenols on it. And that's my dessert of choice, actually, because you're getting, antioxidant benefits with your dessert.
Great. Somebody's asking here, would it be beneficial to meet with a nutritionist for guidance on dietary changes and improvements for and during and after cancer treatment?
Absolutely.
Okay.
Yes, I think the Hunt Cancer Center has a nutritionist that is part of their cancer treatment. So you definitely need nutrition support because some of the medications, the chemotherapy can cause nausea. You have to know what to eat. Things change, during and after. So I think that's I support that. That's a very good idea.
Okay. Somebody's asking here, can you drink almond milk? So I would think that's within the parameters of having cancer.
Yes, almond milk is fine. And you can even make your own almond milk. You take almonds and water and a little bit of vanilla extract, and, you could sweeten it with stevia. You want to use something, or monk fruit, something that is a more natural sweetener, dates.
Okay. Got a question here. Someone asking, are you available for private individual consult?
I'm available. I work in the TMPN network. So I work at an outpatient with Torrance Memorial. So I'm available for consults.
Okay. Well, that looks like the extent of the questions I have. Every once in a while, Miriam and or Nita might get one directly sent to them. I see one more coming in, but Miriam or Nita, did either of you get any direct questions?
No, I did not. I think there are obviously plenty of questions that were
Yes.
asked directly.
So I will ask this one last question here before we go on to our evaluation. Here's the question. Should you cut down on eating a lot of sweet fruit because cancer feeds on sugar?
Well, again, the recommendation is 5 to 7 servings of fruits and vegetables. I rather you eat fruit than a cookie or a cake. And natural sugars, again, when you eat them, is better. That's why juicing is a little tricky, because when you juice, you take out all the fiber, and then that is more of like almost too much sugar. So I would say, as long as you're eating a variety of fruits and vegetables, eating fruit is even, sweeter fruit with a higher glycemic index, it's fine.
Okay, great. Well, thank you so much for all this information. You went through all those slides with so much detail, and of course, staying on to field all these questions. We really appreciate you being here. So thank you, Dr. Alexander Spencer.
Thank you. Have a good night.
Okay, so everybody please stay on just for a few minutes. We're going to launch the surveys and the evaluations.